Perfect. Thank you. Let me know if my internet goes unstable. Hi everyone. As I said, my name is Gemma McNally. I'm currently a doctor working in North London, and this was my undergraduate project taken at the University of Manchester about empathy in students. I think it probably follows on quite nicely from Karen's presentation this afternoon about compassion. So this project was taken, I worked with the Education Centre at the university to kind of improve students' empathy in specifically physician-patient consultations. So what I did first was I did a literature review kind of to see what else was already out there. And the kind of conclusions that we drew from that was that obviously empathy is a core skill essential to patient care. Not just doctors, but kind of anyone that works in healthcare. We also found that patients who feel their doctors are empathetic divulge more about their symptoms and concerns, which then goes on to increase diagnostic accuracy. We also found that there is a decline in empathy as students progress through medical school. And in the UK, how we generally kind of teach students empathy is through simulated patients, and that's examined. But what happens with that is you can have over-reliance on stock phrases like "I'm sorry to hear that," without kind of the empathy and the tone and the body language kind of as background to that. So there's no kind of standard definition of empathy, but there are two components to empathy that are generally accepted. You've got cognitive, which is what is also called detached concern. So that's usually what we teach kind of in medical schools. There's also affective empathy, which is kind of more to be able to join the experiences of a patient, more of a natural empathetic response to a situation. For kind of physician-patient roles, you do need both, but we kind of were looking at affective empathy isn't really taught in UK medical schools. And the way that affective empathy is normally taught is through kind of experiential approaches, and I'll go into that a bit more in a second. So this was just the literature review. So the conclusions that came from the literature review is there's two main interventions that report kind of an increase in affective empathy, which is simulation and patient narrative. What we also looked at is how best to kind of measure empathy. Obviously, it's quite a subjective thing. There was a few papers that measured quantitatively, but the kind of disadvantage of that is you don't get, it's the inability to kind of get that feedback from students. So we thought for our study that we would go more of a qualitative and thematic analysis approach. And we also found that medical students kind of perceive that there's always a cure and there's always a black and white thing to do. So gap that we found is that there was quite a bit of research in terms of different experiential approaches that have been used, but no direct comparison between the two. So we thought what we decided to do was to design an educational innovation that explores medical students' experiences and perspectives of undertaking two different effective focused empathy interventions, and to hopefully formulate some recommendations for other educational institutions. So this was a single site initiative among third-year medical students, conducted as a student-led project, which was myself. It was a voluntary 2-hour workshop, and we focused on the theme of mental health. And we used a personal simulation for one workshop and a patient narrative for the other. And they were split into two groups and then they swapped. So I'll just go into what the different ones were. So the simulation, so the overarching theme was to schizophrenia. The personal simulation was we had students listen to a auditory hallucination that had been made by a mental health worker. Students were told, that they could stop the audio early if they felt too distressed at all. And this audio was kind of classical auditory hallucinations, kind of these intrusive negative thoughts. So they listened to that and then they kind of reflected on that. And then after that, the patient narrative was basically a kind of patient story about how they live with schizophrenia and kind of how it's affected their lives. Students had 5 minutes to read the narrative and then kind of 15 minutes of reflective questioning that was led by a facilitator. Then afterwards, we did a 1 hour kind of big focus group discussion to kind of explore students' experiences. This was then transcribed and thematically analysed. So there was kind of 3 overarching themes. So experiential learning evokes students' empathic responses. The interventions may promote future change in students' practices, which is obviously very important. And current empathy teaching is insufficient and should shift to including experiential learning opportunities as well as the current teaching that we have. So these were kind of just some of the quotes from the theme. So students kind of felt that the simulation generated more of a personal response, but then the patient narrative additionally kind of created this cognitive insight. But both of them, we actually found that rather than one being better than the other, they actually both worked, kind of complemented each other very well, which was kind of an unexpected outcome. So you can see some of the quotes there. And then about promoting future change in students' practices. And then they also kind of commented on how just doing this for one condition can kind of transfer to having that response for other conditions as well. So even this brief targeted intervention, they were talking about future behaviour change for when they do become doctors. And for the last one, current empathy teaching is insufficient, and they spoke about these certain stock phrases that I spoke about at the beginning about you're just taught to say kind of sorry to hear that, just to tick a box, but in your kind of practical exams rather than actually thinking about, you know, what you're saying and being sensitive and things. So as I've said, so both generated students' empathic responses. The simulation seemed to evoke more effective domains, whilst patient narratives additionally created cognitive empathic insight. We said transferability of learning context. They commented that this workshop expanded their understanding beyond the specific clinical condition, as I said before. And there is also transferability to other healthcare professions for these programs. You know, it's not just doctors that talk to patients, it's all healthcare workers. And we also found that even a brief intervention can have lasting effects on students' ability to display empathy. The university is actually currently making revisions to their year 1 and year 2 stage of the programme, kind of with a planned increase in these experiential learning opportunities based on this kind of research. And we've kind of identified some onward questions for future larger scale research, because this was more of an exploratory work. So further work is kind of needed to compare one-off versus longitudinal approaches to kind of help future curriculum development. So as I said before, the other aim was to hopefully formulate some recommendations for other institutions to take this workshop. So we said focus interventions around real patient scenarios that offer students a window into the patient's lived experiences. Unexpectedly, we found actually combining the different empathic interventions together to trigger students' affective and cognitive empathy domains, obviously to create a safe learning environment for students to be able to safely share their preconceptions. And what the students fed back is they thought it would be good to incrementally introduce more challenging scenarios as they go through their degree, obviously, rather than having kind of the easier scenarios towards year 1 and the more challenging scenarios as they progress. They also commented how the 1 hour focus group was good. We kind of acted as a reflective debrief to manage learners' heightened emotions. Because originally that was just for research, but they said it was actually good to kind of have that reflective practice afterwards. And finally, to co-create initiatives between students and staff to inform effective educational design and delivery. I definitely felt, because I was the student doing it, I could empathise with the students more, and I'd gone through the curriculum that they were kind of going through. So it's to have that student staff joined work. There was a few limitations, then I think so. due to resources, we had limited follow-up. Obviously, it was only on one site, and it was quite a small sample size, as it was initially done as kind of a small-scale exploratory work for any future curriculum changes. Some references, and that's it. Thank you very much. Does anyone have any questions at all?